It's 2 o'clock and it's a Wednesday, so it's time for Little Food Explorers. And as you can see, I am not Megan. So I'm sitting in for Megan today. This is the first live that I've done, so do bear with me. I also have to warn you that my internet can be a little bit awkward, and if it does cut out, please bear with me and I will be back with you. We have Suzanne checking the comments box, and I'll keep an eye as well, so you can ask questions. But today's session is going to be all about teeth. So I'm an oral health practitioner and I work with the guys in the Try For You team at Public Health Medway. And I've been doing oral health for many, many years. So hopefully I can give you lots of good information today. So I'm going to chat and I'm going to talk you through some of the important points that I think you'll need to know. And as I say, if we've got any questions, we can go through those as well, maybe at the end, but I'll try and keep a check to see if there's anything that I need to answer as we go along as well. So a lot of information about caring for the teeth of little ones can actually be quite confusing. Often messages are actually mixed or completely wrong. The other thing that can happen is there are pressures from family members about what you should do to care for your young child or baby's teeth. Family traditions. We often find that grandparents have their own ideas about looking after teeth, or maybe not looking after them. Why bother? Sometimes we just aren't sure exactly what to do when we take care of our children's teeth. We maybe know the basics, like we should brush and too much sugar isn't good for teeth, but do we really know why the things go wrong with children's teeth and what we should be doing? So let's start off by talking about why baby teeth are important. So the first teeth start coming into the mouth at about 6 months of age, and they will continue to grow until the child is around 2.5, and then they will have a full set of baby or deciduous teeth. Now I'm going to try and show you a small model, because one of the reasons, you should be able to see this, one of the reasons baby teeth are very important is because they hold the place for the permanent or adult teeth to come into the mouth. And if you look closely at the model, you should be able to see that just behind the roots of the teeth, there are what we call tooth buds developing. So those are the adult teeth developing in the mouth. And this is happening when your child is very young. This model is of a 3-year-old child. So obviously these baby teeth are keeping the space ready for those new teeth to come through. One of the other surprising things is that baby teeth actually start to come out of the mouth at 6 years of age. So we start to get our adult permanent teeth when we're 6 years old, and they have to last us a lifetime. So taking care of those first teeth really is important. There are other reasons that baby teeth are very important. We need teeth to speak properly. Without our teeth, we can't form our words. And obviously young children are learning to speak. They need their teeth to do that. They need their teeth to eat. All of Megan's sessions about food in the Little Food Explorers, without teeth, the child isn't really going to enjoy their food. They're not going to be able to cope with the variety of food. And Megan talks lots about the varieties of foods that we should be looking at giving our children as they grow. They need their teeth to develop socially, so that comes into speaking, but it's also about smiling. If they have a lovely, beautiful smile and they show their teeth, everyone comments. A child who maybe has poor oral health or bad teeth often doesn't smile. So this is all part of their social development, and it is actually part of the best start in life, something that often gets missed. So moving on from why teeth are important, I just want to spend a little bit of time talking about why little children should go to the dentist and have their teeth checked. I wonder if you know that children should be going to the dentist as early as 6 months old, as soon as those teeth are developing. Now, there are lots of dentists that maybe aren't seeing young children, but there are many that are. At the moment, with the coronavirus pandemic, dentistry has had to stop, and dentists had to shut their doors. They opened again around about a month ago, but obviously just general checkups aren't always taking place. So a lot of this information, you are going to have to remember that some dentists will not be able to see young children at the moment, but you need to still actually talk to the dentist about your child going in and having a checkup. We know that children under the age of 4 are probably the least likely to go to the dentist, and below the age of 2 is very rare. So if you are already taking your child to the dentist, well done, that's absolutely excellent. If you haven't, don't worry. It is just a case of getting in touch with the dentist and then seeing when they will be able to take your child in for a dental check, and you'll go with them as well. Suzanne later on will be putting up some information for us, and you can look on the NHS webpage, which should give you information about where to find a dentist locally, or you can just telephone 111 and ask for the information. They will just ask your postcode and they will give you a range of dentists within a 5 or 10 mile radius. In Medway, we encourage all parents to take children from 6 months old, and our dentists locally are fully aware of this. We back this up with something called the Medway Smiles Dental Passport. Now, this was relaunched. It was a pilot about 4 or 5 years ago, and we relaunched it around 2 years ago with Medway Community Healthcare taking ownership. Now, this passport is given out at the first health visitor visit. So when your child really is signed off and you're signed off from the midwife, when that health visitor comes around to see you, they should offer you this dental passport, which ideally you'd keep with your red book for the child. So inside, if we look, we've got space for 5 dental visits, 6 months, a year, 18 months, 2 years and 2.5 years. So that's taking the child through them getting a complete set of baby teeth basically, and being signed off from the health visitor at home visits. The dentist, when you take the child with the passport, should put a sticker in the appropriate age. So at 6 months they'd get a sticker in there in the red section, and they should tell you how many teeth your child has, and you can ask questions. Now, something you might always also see up there, the very top, this DC by 1. That's the British Society of Paediatric Dentistry's campaign, and it is called Dental Check by 1. So they have a campaign that's been running for around 2-3 years to make sure that people are aware every child should have been seen by a dentist by the time they reach their first birthday. So as I say, that's backed up with our passport, and every dentist should be fully aware of Dental Check by 1. Now, obviously, as I say, with the COVID pandemic, it is slightly difficult to get your child to an appointment at the moment. But if you have your own dentist, do make sure that they're aware you have a young child that you'd like to take. Now, I know some of you might not have had a passport. Your children might be a little bit older, but don't worry, you can still go to the dentist. Some dentists do request that you take the red book with the child when they go, so do always ask that. We've got a couple of dentists in Medway that actually really are very strict. They want to know that you've got the red book and that you've read the dental information in that book, so take it along with the passport. And if you should forget to take the passport at a visit, then take it along to the next visit, and the dentist will still be able to record that the child was seen even if you didn't have the passport. Attending early dental checkups is really good for young children. It acclimatises them to the surgery, all those funny smells and sounds. I wouldn't say take a child when you're maybe having a root treatment, but certainly just for their checkup, or if you're having a checkup, gets them used to it. Very young children don't have a fear of the dentist. Fear tends to kick in when they're around about 2, maybe 18 months even. And Megan's talked to you a little bit about that when she's talked about fear of foods. So last week, if you listened, Megan talked to you about how children become wary of foods. And it goes right back to where we sort of had to stop and think about a food, whether it was going to be safe for us, whether it was going to poison us, etc. So, you know, they become wary of things they don't know. And a dentist might look very odd, that funny smell, they might think, oh, what's that? The other thing that is a problem is as parents and adults, we tend to put that fear into a young child's head. So if you've made an appointment for the child and they're of an age where they understand, don't ever say anything like, don't be frightened, the dentist won't hurt you, because that child will just think completely the opposite. So never say anything like that. Be very careful if a young child can overhear conversations between adults about going to the dentist, maybe if someone's had a bad experience. And when we talk about those family pressures, you know, do be careful that grandparents don't say things like, oh, dentists, they're butchers, those sort of things, you know, they're there to hurt you. These are the sort of things young children can pick up on. So do just be very, very careful not to let them overhear this sort of conversation. So that's all I'm going to talk about with going to the dentist. If you have any questions, as I say, please do put them in the comments box, or you can email our Change for Life email address, which is change4life@medway.gov.uk. So let's move on to talking a bit more about toothbrushing, what you can actually do to care for your teeth, your child's teeth every day. So toothbrushing, and we're always going to use a fluoride toothpaste, which I'll show you in a minute. When do we start toothbrushing? Well, as soon as those teeth come through into the mouth. So we're looking at around about 6 months, but some children will get their teeth a little bit earlier than that, and some will be later. We're all individuals. Don't sort of think, you know, my friend's child's got their teeth, my child hasn't got their teeth yet. Stop and think. Each child is individual. Maybe your child was a preterm birth. They might have been born 2 weeks earlier than their due date. Their teeth need time to catch up, so they might take a bit longer to come into the mouth. Generally, we will get the 2 front teeth at the bottom here coming through first, quickly followed by the 2 next door either side. So they have 4 at the bottom, and then the same happens at the top. These teeth are very, very easy to clean. So we start cleaning them the minute they start to appear in the mouth. And it's very easy to do with the baby laying on your lap. So they're just laying into your stomach. If the child's a little bit older, having the child laying on the floor, you kneeling on the floor with your knees so they lay into your knees. Or you can be sitting and they can stand and lay in again just into your knees. You've got more control over toothbrushing if you're behind the child. You can control their arms and their hands as they come up. You can give them something to hold if that's easier. But it gives you that bit more control. It is easier. So the reason we brush the teeth is to remove the build-up of plaque. And plaque is just the sticky film of bacteria that builds up on everybody's teeth. We all have bacteria in the mouth. We all have saliva. Saliva will stick to the teeth. Bacteria tend to stick to the saliva, and gradually food debris sticks to that mix. And that messy mix of bacteria and food is called plaque. And that's what we need to remove. And we need to remove it every day. We need to have a regular toothbrushing routine. And ideally, we do it twice a day. So twice every day, we get into that routine. And the sooner you can do that with your child, it will be instilled in them. And toothbrushing is just a learned life lesson. Brushing before bed is the most important time. And with a very young child that's still feeding at night, then you're working towards toothbrushing being the last thing that you do before they sleep. But if it's just milk or water after toothbrushing, it's fine. The other time is really any other time in the day. Most people brush their teeth in the morning, so before we go to school or work or what have you, that's a routine we establish. But very young children, sometimes first thing in the morning actually is not the best time for them. They might have their breakfast and then be sleepy again. So any time during the day that is suitable for you and your child is the other time to brush. So let's have a little look quickly at the types of toothbrush. So it needs to be a toothbrush that's comfortable for you to hold, but also the child. You know, there's lots of nice colours. We need to look at a nice, small, compact head. So this is aimed as a child at around about 0 to 4 years of age, but it could go on till around 6. That's a very slightly bigger head which would take them through to about 6 years of age. And these are nice grippy brushes for children, but adults should be able to hold them. If you struggle with a smaller handle, you can get brushes that have a long handle, and this is a very small brush. So again, you can get baby brushes with a long handle, which might be easier for an adult to hold, particularly if dad takes control of doing the toothbrushing. So that's the sort of toothbrush we're looking at. What about the toothpaste? The toothpaste is there to help to clean the teeth, so it helps to remove the plaque from the teeth. Obviously it gives a nice fresh taste in the mouth, but one of the most important reasons for using toothpaste is because it contains fluoride. And fluoride is there to help strengthen the teeth. Fluoride is a naturally occurring mineral, and it is found that it helps to strengthen the outer layers of enamel. So when you look at a tube of toothpaste, this happens to be a 3 to 5 year. I'll show you another one, but it should say on there that it contains fluoride. Now this one tells you right down here that it contains fluoride. So right at the bottom. It will also tell you on the back with the ingredients that it contains fluoride. Now, this is the same range. It's just aimed at 0 to 2. Now, there are various reasons why they have different aged toothpastes. Some of it is about the flavour. So the 0 to 2 says it's gentle mint, and the one for slightly older children said it's mild mint, because mint is a slightly odd flavour for a child, can be very strong, and some of them don't like it. There's nothing wrong if they don't like the taste of mint in getting a fruity flavoured toothpaste. You know, when they're very young, if that's what they prefer, that's fine. No toothpaste should contain sugar, but make sure it contains fluoride. Now, the amount of toothpaste you use is quite important. I'm going to try and show you on one of the brushes. So this is the younger child, 0 to 2. And for children, it's actually 0 to 3 years old. So when it says 0 to 2, it means really until they get to their 3rd birthday. So right through the age of 2. So you would use a tiny smear. So a very tiny smear of toothpaste. No more than that on the brush. You're only cleaning a few teeth initially anyway, and you don't want to make too much foam in the mouth, because all the child will do is just dribble it out, and they will just go blub, 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 and you won't be able to get to the teeth. So what do we do when the child is a little bit older? So by 3 years old, then we're going to use a little bit more. So we're going to use a pea-sized amount. So again, if I pop it on the brush, we use a little bit more. Well, that was slightly too much, that's it. So around about a pea-sized amount of toothpaste for a child 3 and above. And you can push that into the brush a little bit more if it's easier. It's not the amount of toothpaste that you use that is going to help strengthen the teeth. Using more toothpaste won't help clean or strengthen the teeth anymore. It will just make it far more difficult because you build up more foam in the mouth, so it's messier. And as I say, the child won't actually be able to keep their mouth open. What you need to be aware of is what we call the concentration of fluoride. And this is slightly more, I don't know if I can show you, but with younger children under the age of 3, the way they measure it is what they call parts per million, or ppm, and then it will have a capital F for fluoride. And right down here, this one has 1,000 parts per million. And then when we look at the older toothpaste, it has 1,450 parts per million. And this is the government guidance that children under 3 should have no less than 1,000 parts per million concentration of fluoride in their toothpaste. Once they reach the age of 3, they need the higher amount, and that is between 1,350 and 1,500. Most companies go slap bang in the middle and do 1,450 parts per million fluoride. And that then is the amount you would have until you, well, right through adulthood. You don't have a stronger concentration of fluoride. And you shouldn't be able to buy a stronger concentration of fluoride legally in this country. It would only be prescribed by a dental professional. So the concentration is the most important thing, and I'm sure Megan's talked to you about food labelling, so you're going to have to read toothpaste labels a little bit as well, but just make sure that you've got the right amount. Now, we did have a question, and I am fully aware that sometimes brushing little one's teeth is not as easy as it sounds. My grown-up son was a terror when he was younger, and brushing his teeth was not a lot of fun, but we did it. One of the things we need to be aware of is, again, thinking about what Megan said in her previous lives, is how children develop and that they want to begin to take control, and they do have this neophobic stage where they push back something that they've accepted previously they don't want to know, and toothbrushing can be one of those things. The other thing you need to be aware of is right through this development period until they're 2.5, they are developing their teeth in their mouth, so they are teething, and teething can be painful. You might not realise they're teething, but their mouth might be sore, and it would be a good reason for them not to want you to poke a toothbrush into their mouth. So that could be a reason for them pushing the toothbrush away. What you need to be careful of is that you don't turn toothbrushing into a fight. Try and make sure the child isn't tired when you're brushing. Try and give them a bit of ownership. You do need to, as much as possible, brush their teeth, but there's nothing wrong in the child brushing their own teeth and getting the fluoride toothpaste onto the teeth and in the mouth in the first instance, and then you going round and particularly paying attention maybe to the back where they might have missed, so the teeth are developing at the back, the fourth one round on either side, top and bottom, from 15 months to around about 18-20 months. So at that age, they might miss those back areas. You need to make sure you get there. Don't worry if the child closes their mouth, clamps it shut. When a clamp's shut, you can get in through the cheek. The cheek's nice and loose. So if they clamp their mouth shut, don't argue with them or shout at them to open their mouth. Just literally, with your finger, move the cheek away and put the brush in. And gradually, as you're brushing the outer surface, they'll open their mouth and you can get in and brush the inner surface and the biting surface. Don't ever chase a child around the house with a toothbrush. Don't ever let them run around with a toothbrush in their hand. If they put it in their mouth and they trip or fall, that toothbrush could go through the roof of the mouth, the soft palate, and could cause injury. So don't ever leave a young child alone with a toothbrush or allow them to walk or run around with one in their mouth. They're going to require help until they're around 7 or 8 years old because they need that dexterity. It's very easy with a toothbrush. If you're right-handed, it's easy to clean the left side. That's an easy movement. That movement turning the brush is not easy. And for left-handed children, it would be the other way round. They would clean the right side and not manage the left. So be aware of that. Be aware of their dexterity. Can they use a knife and fork and a spoon? As they're growing, what's their writing like? Can they draw a circle? All these things. And normally by the age of 7 or 8, they have the dexterity and then can be allowed to clean their teeth by themselves. But obviously you supervise and make sure that things are going right. And unfortunately is that squeaky wheel reminding them twice a day they need to clean their teeth. And you not forgetting, you know, make sure that you're there to remember. Thinking about cleaning the teeth, I'm trying to think of anything else I need to tell you. I don't think there is anything else about cleaning the teeth. So I'm going to move on because I'm aware of the time and we're already gone 20 past. I can't see any questions. So I'm going to continue. I'll talk a bit about sugar and then try and talk about drinks and beakers for you. Hopefully we won't run over. So Megan's talked to you lots about sugar and not adding sugar unnecessarily to foods. Megan's talked to you a lot about snacks and keeping snacks sugar-free, and she's given you recipes and examples of that. You have to remember that sugar can cause tooth decay. The bacteria in that plaque can break the sugar down and they can create an acid which just literally rots the teeth. And baby teeth rot very quickly, unfortunately, so tooth decay can happen quite rapidly without you knowing it. Another good reason to have that routine of removing plaque twice a day. think about what you're giving children, because the frequency that you give them sweet things, whether that's sweet treats like biscuits, sweets, it's also about drinks. If you're giving those things frequently, you are heightening the risk of your child having tooth decay. So sugary snacks have no place in a child's diet. Make sure snacks are sugar-free and limit the amount of sugar that's given at meal times. Dried fruit is often talked about as a healthy snack, and it is a healthy fruit, but because it's been dried and it's been broken cell walls and all the water taken out, actually the fruit sugar is available to the bacteria and it's very sticky. So it's not a good snack for young children, and very young children, very tiny children could choke on dried fruit. So it's not a suitable snack. You can have it at meal times, maybe mixed in with porridge or something, but not as a snack. And many foods and drinks contain sugar that we're not aware of. So do make sure you read the labels. So I'm going to move on to drinks, because I know Megan will have covered most information about sugars within foods. And when we talk about drinks, they are often blamed for young children having tooth decay. So I think one of the best messages to remember is that milk, whether it's cow's milk, breast milk or formula milk, and water are the only drinks that are tooth friendly, that will not have an effect on the teeth. Sugar-free drinks can affect the teeth because they're acidic. Baby juices will have fructose, which is fruit sugar, which can cause the teeth to decay. And one of the worst things to do is to suck a drink, so using a baby bottle or a beaker that has a valve in it. So any drink that you give your child needs to go into a cup. So you can, from a bottle, from a very early age, you can just use a very small open cup. Make sure it's not a rigid plastic that can break if they chew on it. This is nice squishy plastic. Okay, so a very small cup. You're not giving much, particularly if you're breastfeeding. They're getting plenty of milk. They're not going to need a lot of extra liquid, but just as top-up liquids, these are absolutely fine. And if they spill it, it doesn't make a huge mess. The other sort of cup you can get are beakers with spouts. So you can choose to have a beaker that you just take the lid off. The child's got control because they can grip the handles and they can bring it to their mouth, but don't fill it up. Filling it up, they're just going to spill it all down them. So, no more than a third to half full initially if it's open. If you use the lid on it, that's fine. The spout needs to be what we call free flow. So free flow means the drink comes out of it without sucking. There is no valve here between the spout and the holes in the spout. If it has a valve, then they have to suck, and that's a non-spill beaker. So free flow. So this particular one, and a lot of them will tell you, it will have the label saying free flow. So it means the drink just comes straight into their mouth, because if they suck the drink, they're bathing the teeth in any liquid that's coming out of the bottle or the beaker. And if that has sugar in it, then it will cause tooth decay, and it can be very, very rapid in those baby teeth. So please keep any drinks sugar-free. If you want to give a juice, then do so at meal times and dilute it well, and only offer it, remember, in a small open cup or in a free flow beaker. A lot of beakers, remember, these are quite readily available, and they're quite a cheap beaker to buy. Some beakers are very expensive, and in all honesty, are just bottles in disguise. So do be aware. If you are breastfeeding, try not to introduce a bottle. Try to go straight onto a cup. Even if you're expressing your milk and maybe putting it in another vehicle, try giving it from a very small cup. Most young children can cope with that if they've breastfed. Breast milk comes into the mouth very, very quickly, so they've actually got that gulp mechanism. That's what we're developing. So they get the liquid in their mouth and they gulp it down, and that strengthens these muscles as they gulp, and then they're able to cope with an open, free flow drinking method. There is a cup called 360. I don't know if anyone's heard of that. I actually haven't got one. I haven't been able to get hold of one. They are a cup with a lid that actually, it doesn't matter where you drink from around the rim, the drink would come out. And there's been a lot of debate, but they apparently are classified as free flow. So those are fine, they're okay. The other thing when babies are drinking or young children are drinking, make sure that they are sitting down. Don't allow them to run around. If they're sitting down, you don't need a non-spill cup. With baby bottles, if you're using bottle feeding, you can put water in a bottle, that's fine. Some children like a bottle later at night, that's fine to have by the side, but just milk or water, nothing else should be in that bottle. And when you're going out and about and you maybe want to quench baby's thirst, don't just think I'll have to take a bottle or a non-spill cup. Think about taking your own bottle of water and a little beaker. So having your own bottle of water and a small beaker, that can just go over the lid quite easily, and then just decant into the beaker when the child's thirsty. Okay, so just to finish up before we look and see, I don't think there are any questions, but just to finish up, the reasons that we need to take care of children's teeth and we need to take note of the things we've talked about is because children's young teeth can decay very, very quickly. And the only person who can tell you if the teeth are decaying, unless the child is in pain, is a dentist. So that goes back to the early dental visits. But children who have decayed teeth might have difficulty eating, so they don't get the variety of foods. They can experience pain, and nobody wants their child to be in pain. If you've had toothache, you will know it's a very uncomfortable thing and you often can't sleep. They might also get other health infections, so that they might suffer poor health because of that tooth decay. They might miss out on days from nursery and eventually days from school. And in the end, if the decay isn't treated, the teeth can rot completely and they might actually have those teeth taken out under a general anaesthetic, which again is not something we would want for our child and is not the best start in life. So really establishing those good habits, a good toothbrushing routine, going to the dentist, not giving sugar in between meals, watching what sort of beaker you're using, all those things are really important. Now I've looked over at the comments, I can't see any questions, but if you do have any comments or want to ask any questions, then please do comment either on the A Better Medway Facebook page, or you can comment, as I say, at Change for Life at medway.gov.uk, and I will answer those for you. And obviously you can, this is recorded so you can listen back to this. But can I just say thank you all for listening. I hope that I haven't put you off not being Megan. She'll be back with you next week. And thanks a lot. It's been lovely. So see you soon maybe. Bye for now.